A 73-year-old woman with a history of anterior myocardial infarction is depicted in this echocardiogram. There is a mild pericardial effusion visible in this view, and a large apical aneurysm can be seen in this four-chamber view. However, what makes these patients critically ill is illustrated in this view. A turbulent flow in the apical portion of the interventricular septum, which is indicative of interventricular septal rupture, IVSR. IVSR is fortunately rare, but it carries a poor prognosis without prompt intervention. Mortality is often due to heart failure and cardiogenic shock. Management involves a stabilization with inotropic supports and vasopressors followed by surgical repair, which is essential. Percutaneous closure may be considered in selected cases.